Hi everybody. Women are often given confusing messages about HRT and it is so painful for me to watch and for me to try and fix. From celibacy to hot flushes, risky HRT, let me explain the most common menopause myths. Menopause has long been a taboo subject, but that is changing, fast but not fast enough. Recently I presented a report for BBC's Inside Out which debunked some of the most common menopause myths. I also regularly appear on various TV stations and try and correct the countless non-truths around women's health. Yet, despite all of this, I still hear from patients who are understandably confused by the amount of misinformation that persists, often from doctors. So in my continued bid to separate fact from fiction, here are the top myths that I hear constantly. Menopause only affects women. Look, whilst menopause clearly is a process that certainly only affects women, men are affected by it massively. What do I mean? We need to talk about this. Men are affected because they see their partner, sister, mother suffer the symptoms. Sometimes they're at the brunt of those. Relationships become difficult or break down. The women around them can no longer function as mothers, carers, partners. They lose their jobs. Household finances suffer. And additionally, men do lose testosterone as they reach 40 to 50, and this can cause similar symptoms to menopause and is called andropause. But there are plenty of private clinics that will treat men for this, although the NHS is still a little reluctant. So this is actually an issue that will affect every single person at some point in some way. Menopause starts at 50 and over. Look, the average age of menopause in the UK is 51, but it's an average, meaning there are younger and older women in that mix too. Also, bear in mind that this figure is the point at which women's periods stop completely. Perimenopause, which is the time leading up to those periods stopping for good, can last for 10 years before this. So a woman can be perimenopausal with symptoms throughout their entire 40s. Then there are the women who go through premature ovarian failure or surgical menopause where their ovaries are removed, plunging them into early menopause as young as 20, in fact some teenagers even. They then potentially have decades of symptoms, and so treatment is arguably even more important for them. This means women may be seeing their GP for menopause symptoms which are not being recognised because of that assumption we started with, that she's too young. Hot flushes are the first sign. Hot flushes and night sweats are common, but many women don't have either. My experience is that anxiety and mood changes and depression are probably the earliest symptoms, and these often go unrecognised as menopause symptoms. So if you have never previously suffered from anxiety, low mood, and suddenly the world is a dark place, or you've had anxiety but it's really ramped up, or it's worsening in this period, see your GP and ask if it's perimenopause. Bioidentical hormones are not available on the NHS. The expensive and private clinics that sell this would love you to believe this is true, but it just isn't. Body identical and bioidentical mean the same thing. Hormones made from plants, usually yam, that mimic your own hormones exactly. And they are definitely available on the NHS and are arguably safer because we don't mash them together or deliver progesterone in a cream. Ask your GP for estrogel and utrogestan, which is a totally bioidentical combination and can be tailored to suit you. And don't forget, there are so many ways to have HRT: tablets, patches, gels, or a combination of these. You can't have HRT while you're still having periods. Again, I hear patients who are told this by friends and sometimes even by their GP. It's not true. For the 10 years leading up to menopause, you may still be having regular periods, might be irregular, and have full-on symptoms which can be treated in the same way as if your periods had stopped completely. It can sometimes be harder to find a balance and to control bleeding during this period, but a good GP can and will help you and will work with you as your hormones change in the background. You can only have HRT for 5 years. Now this one I hear almost daily. The NICE guidance says that under the age of 60, the benefits of HRT outweigh the risk. After 60, it's a discussion between you and your GP and an assessment of any risks, and there is no time limit to stop. There is a suggestion in the NICE guidance that you should use the lowest dose of HRT for the shortest amount of time, but there is no set stop time, and for some women, they need it for life. Fat people can't have HRT. This is just not true. Weight, migraine, smoking and diabetes are reasons I hear that women have been declined HRT for, and all are false. I think it's cruel. Your weight has no bearing on your suffering, and we should not be withholding this critical treatment for no scientific reason. As your breast cancer risk and clotting risk is raised if you're overweight, I would suggest choosing a delivery method that minimises these risks, like gel and micronized progesterone. But guys, it's still your choice. Perimenopause means no more babies. Definitely not true. Many a 50+ woman gets surprised by a perimenopause baby, and until you've gone for a year if you're over 50 and 2 years under 50 without a period, you need contraception if you don't want a baby. HRT is not contraceptive, and women do get pregnant taking it. So if you're not quite ready for a baby, don't take a chance. It only takes one good egg. The symptoms are all physical. Sadly not. There are lots of hidden physiological and mental health symptoms. Depression, anxiety and mood changes are common, affecting every aspect of life. The ability to think clearly, find words, concentrate are often lost, being described as brain fog. Our bones, heart and brain are also left unprotected by estrogen after menopause. 50% of women get osteoporosis and just 20% of men. Heart disease is still the biggest killer of women, but usually only develops after menopause. And women get dementia twice as often as men. Estrogen is important, guys, even when you think you have no symptoms. Only men need testosterone. Women only have a small amount of testosterone before menopause. It's about 10% of their total hormones, but its loss can make a major difference. Loss of libido is common, alongside fatigue, energy, mood, and sometimes only testosterone replacement will bring it back. Bladder issues are inevitable with ageing. This might be true, but it's the loss of estrogen that causes them in most cases, and I see women who have cystitis type symptoms making life miserable after menopause. They have often had every test, every antibiotic a urologist can find, and the problem is often solved within weeks with a little bit of topical estrogen. Your sex life ends with menopause. Goodness me, why should it? You've got another 30 years of life. Certainly sex can become painful as women get vaginal atrophy, but there are answers and it really doesn't have to be the case. Combinations of vaginal estrogen, moisturisers, lubricants, laser, red light and or HRT can bring back the intimacy. Taking HRT just delays menopause and you will always get symptoms when you stop. Nonsense. Every woman is different and your body was going to do what it would or wouldn't have done with or without HRT. So if your symptoms were going to last 7 years, which is the average, and you take HRT for 7 years, when you stop, you'll have no symptoms. If your symptoms were going to last a lifetime, they will always be there when you stop HRT. HRT can't and won't change that. All it does is take the symptoms away while you are on it. Women are not allowed to have HRT tablets because they are dangerous. Sounds silly? Nonsense, I know, but I hear it often, even from GPs I work with, who tell women that they cannot have tablets for this reason. If you've watched my HRT vlog, you will know that in terms of comparison, tablets are riskier because of DVT, blood clot, stroke, but it's small, the risk is small, and for some women they are prepared to take that small risk and want to because a pill suits their lifestyle. If a woman has a history of blood clots, then no, they can't have a pill, but other than that it's their choice. So that's my whistle-stop tour of the common menopause myths and my responses. I hope it helps, and if you want HRT, this helps you achieve it and puts your mind at rest. Take care, guys. Good to see you.